We have the Vice President's Chief of Staff here.
On behalf of my boss, who is not present, that is present. Like 4 months or something. Bring it on.
We also cannot go above the Minister for Health. As colleagues, the three of us here, we are doing a magic.
Our boss, can they go beyond you? Your boss says you can go beyond.
Now, on behalf of my colleague directors, the ministry, we are also pledging the support of 20,000 towards this on behalf of New Crystal Health Services, the leading private health sector provider in Ghana. We are giving 10,000.
So, I am managing and then my wife said, Miss Mijinaha. Me a diabetic patient. Every baby, a tremono. Yahoo say a penny for Yari, and I know Musica, Omudi, Swatchy, and Omunia. But he said, Adia Yaria, I bet my back in Polamusu. Minya, no, I check a cry. But me protecting me who can cry, and Miss Metinasi, I check a cry. Yaria, Bonipa,
institutions whose mandates are critical to the successful implementation of the Ghana Medical Trust Fund, to offer their full support and collaborate closely with the Ministry of Health. Together, we can ensure the successful realization of this transformative, life-changing initiative. Ladies and gentlemen, as I conclude, allow me to express my heartfelt gratitude to His Excellency John Dramani Mahama for entrusting me with the honor of facilitating the design and implementation of this groundbreaking health initiative. I remain optimistic that the people of Ghana, and indeed future generations, will cherish and appreciate the immense impact of this remarkable legacy. I also wish to express my sincere gratitude to the task force under the distinguished chairmanship of Reverend Professor Emeritus Seth Aidi, and to all the technical experts whose invaluable expertise made the design of this sustainable trust fund possible. Further appreciation goes to the drafters of the bill and the dedicated staff of my ministry who worked tirelessly towards the realization of this visionary project. Finally, I extend my deepest thanks to the many Ghanaians who voluntarily participated in the national survey and expressed their unwavering support for this life-changing initiative. Your voices have been instrumental, and I assure you that we remain fully committed to serving you with dedication, placing your needs at the very heart of our efforts. On this note, I leave you with these words, and I quote, "When we invest in NCD financing today, we ensure a healthier and wealthier tomorrow." Your Excellency, at this point, permit me to invite Professor Seth Aite to give a very brief remark. Thank you.
Your Excellency, President John Dramani Mahama, my very good friend. Distinguished ladies and gentlemen, members of the task force, I deem it a great honor to be asked to speak on this historic occasion. Honorable Minister has already summarized our report. you will find data, you will find graphs that tell about the suffering of so many people. But what you will not find in that report are the stories of these people who have been captured as data. People who are broken, whose homes are shattered. These stories broke our hearts. These stories touch us deeply. And I know His Excellency the President will move from resetting our minds to resetting our hearts through this initiative. As a task force, on many occasions as we heard the stories of patients who are suffering through chronic diseases, we wept. Our hearts were moved, we wept. Our hearts were broken by the state of their lives. And we wanted to do everything we could to help. We also wanted to mobilize as many Ghanaians as possible to support His Excellency the President. There is a story that I'll share with you to end my brief remarks. And this is a story which is referred to as the starfish story. Some of you may have heard about it. In this story, a storm had washed ashore thousands of starfish. And there was a young lady, young girl, who walked the beach and would find a starfish and throw it back into the ocean. Many watched her in amazement. An old man who saw this lady called her and wondered why she was doing that, because there are thousands and thousands of starfish and she wouldn't be able to save them all. Then this young girl, getting discouraged, bent down and took another starfish and threw it into the ocean and said, "This one counts." And soon the old man joined her. And then all those who were looking on also joined. And before long, they had moved all the starfish back into the ocean. Your Excellency, God has used you as an instrument to move or begin to move the hearts of Ghanaians and friends of Ghana and your friends and families to give and give and give and give, so that every single person with a chronic disease will rejoice, will have hope. We can save as many of them as possible so that they can get back to work. In Exodus chapter 2 verse 9, something significant happened. Moses, who had been put on the Nile in a basket, was seen by Pharaoh's daughter. And then, to cut the long story short, Pharaoh's daughter wanted a nurse to look after this baby for her. And Mariam, a sister of Mary, went and called Jochebed, the mother of Moses. And when Jochebed came, Pharaoh's daughter said to her, "Take this child and nurse him for me, and I'll give you your wages." Your Excellency, you entrusted to us this beautiful baby that you birthed. And we have nursed that baby for you. We are not asking for wages. Rather, as chair of the task force, on behalf of my family, myself, we are presenting an adoring gift.
Wow.
It's a cooking gift to you. And may this be the beginning of greater community. May God bless our nation Ghana. May we all obey the command of our Lord Jesus Christ. And he said, this is my command, love one another. Greater love has no man than this, that a man lay down his life for his friends. John 15, 12, and 13. On this note, Your Excellency, thank you. May I humbly ask that members of the task force stand. I think some of them are right. Please stand and I could sleep soundly because they were there to work morning, afternoon, and evening.
And surgeons, please just welcome the warmly.
Your Excellency, President of Ghana, John Dramani Mahama, the Honorable Minister of Health, Kwabena Minta Kando, observing all the protocols that have been well established by the Minister of Health, I thank the organizers of this gathering, this historic event, for asking me to speak briefly. I'm here on behalf of the heads of agencies of the Ministry of Health, and especially on behalf of the rectors of the postgraduate specialist training colleges, to say that just like Reverend Professor Aite said, His Excellency has brought the baby out. He's created the legal environment for this Mahama Cares initiative, and the task now falls on us as heads of the agencies of the Ministry of Health to make sure that this works. So I'm here to say on behalf of all the heads of agencies that we are committed to making sure that this Mahama Cares initiative works and that Ghanaians feel the full benefit of this. I'm here especially representing the postgraduate medical colleges as we talk about this, because for this initiative to work, we need specialists to provide the leadership. And many people appreciate the work of specialist doctors and talk about that. But many of us are a bit blind to what specialist nurses and specialist pharmacists do. But then I'd like to just let all of us know that we need specialist nurses, we need specialist pharmacists, and we need specialist doctors to make sure that this is delivered. This is not a thing that is done only by doctors, it's done by the whole healthcare force. And whatever is being done to make this initiative work should not selectively choose some members of the healthcare force. It should cover everybody equally. Having said that, I'll talk about what I know. We at the Ghana College of Physicians and Surgeons have done some analysis, and we've realized that we need about 6,500 additional specialists for us to be, of all categories, for us to be able to deliver the kind of care that is needed by 2030. Currently, we have about 2,000 specialists in training in the country. So there's quite a bit of a gap. However, mathematically, we can actually halve this gap if all regional hospitals in the country are fully delivering postgraduate training. And would like, Your Excellency, now that we have your ear, to ask you to lean on the Minister of Finance, and all other people involved to make sure that this is delivered during Mahama Chapter 2. We believe that it is possible in 4 years to have all the regional hospitals fully delivering a certain set of postgraduate
existing protocols. On behalf of the Health Development Partners, allow me to congratulate the Presidency, the Government, and the Ministry of Health on the launch of the Ghana Medical Trust Fund initiative, a visionary step towards equitable healthcare and sustainable financing for the fight against non-communicable diseases. This initiative is in line with the vision of most health development partners, who aim to ensure Ghanaians have access to quality healthcare services, including for NCDs. As you know, NCDs are a major public health challenge that undermines social and economic development and can increase inequities within populations. Today, as mentioned by the Honorable Minister, NCDs are the leading cause of deaths worldwide. Low and middle income countries are also affected. In Ghana, the share of NCDs in the disease burden is increasing, and this is mainly due to an aging population, rapid urbanization, and changing lifestyles. Most premature deaths from NCDs are largely preventable. Through the development of multi-sectoral public policies beyond the health sector to prevent exposure to key risk factors such as tobacco and alcohol abuse, and healthy diets and physical inactivity. Furthermore, there is a lot of evidence that supports the implementation of cost-effective preventive and curative intervention in health services. Strong leadership and urgent action are required to achieve this, and we commend the government and the Ministry of Health for their leadership. However, as always, sustainable financing remains a major challenge and requires innovative thinking, and we commend the uncapping of the NHIL for this purpose. The remarks by the Honorable Minister unveil important features about this important initiative, but we look forward to learning more. Health Development Partners stand ready to provide the necessary support to the Ministry of Health and its agencies to help save lives, improve the health of present and future generations, and ensure that the human, social, and financial burden of NCDs does not undermine the development progress made in Ghana in recent years. Thank you and congratulations once again for this transformative initiative.
Mahama, and in the chief for Nina, any penny for Nina Muaha, in the massive Shiam. I don't find so. I am a lady, and the man was a Miss Mijinaha. Be a diabetic patient. And maybe brave tremono. Yahoo say a penny for Yari, and I knew Musica, Omudi, Swatty, and Omunia. But in said, Adia Yaria, I bet my back in Polamusu. Ninya, no, I check a cry. Ba me protect me who's a crack, and Miss Metinasi, I check a cry. Yaria, Bonnie Pa, a Mawa cry, but Namiadum, it was Metinasi. Nti dia me kan say sisi ano ebia ba me ban susu me gusu a me solve but enye yare a ebe pop you better take care of Nti dia mede ba ne sɛ Nyankopɔn emboa yɛ na ntimi sum. But I did a crime can say, yeah, Bruno. I am a boarding. Me, I'm meeting a hand, me a single parent. I won't collect dream. Me to be chefy. Now I do, Nakatamato, no matter my colanaso. I yet the mammy, at times the baby cry. Yammy label. See, me, I just read say. I best say, my penny. And young boy, ma edrono na yetimi nya do na ye fa keke yare we afi yesu do se en kobatie be prevent ma dia onni bi no ono su benya edroni bi e dia preventing no edanasi se mahama ke na odi bae no edanasi bebre se nya me nhira so na adwempa ayamaye se ofa bi e wo mu maye no empremu.
On the client, I'm looking at. I've seen Alaji say Dragombo. So he will do 3 months. Thankfully, there are 3 ministers.
We also cannot go above the Minister for Health. As colleagues, the 3 of us here, we are doing a marriage. Thank you very much.
Well, we have the Vice President's Chief of Staff here. We have the Deputy Chief of Staff outside. We have the Secretary to the President. And I see Corporate Ghana. I see CalBank. I see MTN. I see Telecel. I see NHI boss. I see Ghana Health Service Director General. The task force, you are exempt because you're giving a gift. But if you are willing to also do it, you can do so. I see the rector, physicians and surgeons also here. So any takers, let's do this quickly. The president has to leave us. Any takers? Oh, I should see. Okay, I see a young lady. How much, please? Let me write. Who's taking notes for me?
Dr. Brempom, presidential staffer, working closely with the Ministry of Health. I also pledge a month of my salary.
On behalf of the Ghana Health Service, and of course, I cannot go beyond my board. Health insurance will also pledge 1 month of our salary.
1 month. Our boss, can they go beyond? Your boss says you can go beyond. Yes.
On behalf of my boss, who is not present, that is present, pledge 4 months of my salary.
Yes. My name is Chief Director of the Ministry of Health. Now, on behalf of my colleague directors, the ministry, are also pledging the support of 20,000 towards this.
Thank you so much, Calvin. Your beauty is on the fire. Madam. Thank you so much. Two more, then I will see you. And then the very last one.
I'm speaking on behalf of New Crystal Health Services, the leading private health sector provider in Ghana. We are giving 10,000.
Even by your Okay, so at this point, we will be communicating platforms. Since we have our telcos here, they've made available platforms where you can contribute from the comfort of your home, wherever you are, you can contribute as well. But the short codes, can we give more than 50,000? Keep standing now, we'll take the national anthem, please.
Yeah.